Okay, I'd like to welcome everybody back in. We will get started with our next session, The Secret About Employee Assistance Programs. And we have joining us today, Leah Boggs from USI. Leah is an accomplished health and wellness professional who brings a wealth of experience to USI as a population health management consultant for the Midwest region. With a track record of more than 15 years with USI, she has worked with a variety of industries, including healthcare, manufacturing, pharmaceuticals, universities, profit and nonprofit groups, assisting in the analysis, integration, and evaluation of lifestyle services and programs. Leah developed the first wellness initiatives for USI clients and implemented the first wellness training program for the Cincinnati market. She holds a health and life license and has worked in the benefits fields for more than 28 years. Leah, thank you so much for joining us today and helping our attendees learn a little bit more about employee assistance programs.
Thank you, Jen.
Thank
It's great
you.
to be here.
Yeah, we appreciate you being here. So Leah, I know I've got a lot of years as well in the benefits industry and serving, corporate and field employees or our clinicians. And I think one of the things that's most helpful is just helping them to understand what an employee assistance program is. What does that mean?
Absolutely. So first of all, thank you to all our healthcare workers out there, because without you, we would all be lost. And so we really appreciate everything that you do on a daily basis. I could never do everything that you do, but I can tell you about all the different programs and services we can offer too. So from an employee assistance program, those programs were put into place years ago and many times were hidden. And it's really a mental health program designed to assist where the need exists. So for instance, it can be therapy programs, it can be coaching programs, it can be legal services, child care help, elder care help. It is really an extensive mental health benefit that is typically offered through an employer group in one of two ways. It's either a standalone EAP that your employer purchases, and they purchase a certain number of sessions, 3, 6, 8, typically are the standard session models. And it's usually housed on your intranet, where it would say the name of the vendor and the 800 number where you could access care. Or another way that the benefit is offered is through a free program that's typically offered underneath a short-term disability or a long-term disability or a life insurance policy. And that's typically where those vendors have contracted with an EAP to offer a limited benefit, which would be probably a 3-session model. And once those sessions are expired, you can continue care, but at your cost through your medical plan, if that makes sense.
Yeah, thank you, Leah. Are employee assistance programs always just available to employees of the company, or do any of the services extend beyond the employees?
Yeah, great question. It typically always extends to household members, children. If someone's living, you have an in-law living with you, it would extend to that individual as well.
Okay, fantastic. One of the things I hear most often, or maybe the most common myth about employee assistance programs, is whether or not they are truly confidential. Can you speak to that?
Absolutely. So they are truly confidential because a lot of this information is much like your HIPAA guidelines, where it's protected health information. And there are very stringent privacy laws that all of these vendors adhere to. So I can assure you, none of your information is ever shared with an employer group. What's shared with an employer group is information such as you had high touch points for stress-related incidents, or attorney services that were needed, or childcare services that were asked about. It's always an aggregate of what type of resources are being requested so that we can continue to build upon those resources in other ways through your benefit plan structure, if you will. Even as far as food insecurity, don't have the proper access to getting myself to work. It's things like that you don't think of on a regular basis. So when we're talking about social determinants of health, which I know all of you are familiar with, we're even getting into that level of detail to kind of help bring the resources available to the people when it's necessary and needed.
Yeah, thank you. I think that's a really important point to call out, because I think a lot of organizations see lower participation in their employee assistance program because employees are not confident that there is that confidentiality when they're reaching out and leveraging those resources available. So thank you for that clarification.
Can I add one more thing, Jen?
Yeah, of course.
The other item to acknowledge here is when you go into access an employee assistance program, we're not using any form of your ID membership at your organization. You're setting up your own ID with that particular coach or therapist so that you have that direct contact, and it's not flowing through any other source other than you and the coach or provider that's helping you. So I think that's really important to note as well.
Yeah, absolutely. Absolutely. I know we talked about, there's a variety of services and resources that can sometimes be hidden within an employee assistance program. But can you talk about some of the benefits that would support mental health and mental well-being that exist in EAPs?
Yeah, so there's so many different components to mental health, right? We all know that just from day-to-day situations. And what happens for me is going to be different than what happens for someone else. So what I really like about the EAP space today, when COVID hit, EAP was always in the back room. No one ever wanted to talk about it because of confidentiality and because there was a stigma tied to that. But that stigma has slowly been removed because the need is so great. And I'm so happy that it's front and center so that people can get the services that they need so desperately. And so I just had a request today that asked if an EAP, I'm trying to remember exactly how he said it, I'll think of it in a minute, but I got a request and I thought, oh, no, the EAP would not handle that. However, I know it was. Someone was out of their house and having a hardship of trying to figure out where to go and what resources were available. So the question was, would the EAP take care of that? Well, they will to a certain point. What they'll do is they will navigate you to the appropriate resources, agencies, whatever's in the community that can help address that need at that time, and they'll navigate you through that. So for instance, in prior years, you call 1-800 number, you either get a coach or you get a provider and you're on your own. Today, that's not how an EAP works. You call that 1-800 number, you are incepted by an individual who is going to stay with you through the course of getting you to the appropriate care setting. And they ask a few questions so that they know if you need coaching or do you actually need therapy. Some individuals just need help with a situation. They're just lost. They don't know what to do. So they might need 2 visits to get them on track with, oh, I never thought to acknowledge or go down this path to address that. One and done. And then if they call in later, that session model, it starts over. So, but back to your point. So there's so many different areas that the EAP can address, right? From a legal and a financial perspective, it's typically a 30-minute consult to determine what your need is and what you're looking for. And if they can help you address and answer those specific questions, then they will. But if they have to refer you out, then they're probably going to refer back to any resources your employer might have. And the EAP may be familiar with all your benefits so they can navigate you appropriately. Or they'll refer you out to whoever they use or whoever's in their service line to be able to better assist you. Yeah, assistance in finding elder care if you're taking care of a parent and you need to work and you're not quite sure what resources are available in the community, they will help get you those resources. You have a situation where perhaps there's a disability in your family and you need help building a ramp to get into your house. They will direct you to the appropriate care or resource to be able to come help you complete that task. They're going to make sure they're connecting you with the resources so they're not just leaving you to try to figure that out on your own, because that's cumbersome and it's overwhelming, and
Yeah.
it's a great place to be able to go and have the assistance.
Yeah. You've mentioned resources beyond, mental health. You've talked about legal or financial resources. Um, can you help our audience understand what an EAP may be able to support from a legal and a financial standpoint versus probably where they're going to have a handoff, or maybe there's a better resource for employees?
Yeah, if they're just looking for, okay, you're in a situation where perhaps you're contemplating divorce. And what's that going to look like for me if we go down that path in relation to split incomes, who's going to have the children, everything that you might not be able to grasp onto and what you're going to have to deal with through that particular situation. That attorney is going to help map out what this might look like, what you're going to need to be able to further the conversation with an attorney if you take that path. They kind of map out everything, every aspect of that particular situation to help you plan appropriately. And the same thing with financial services. If you're looking for, how do I repay student loan? How do I get my finances back in line? They may help you develop a plan and build out, let's say, an Excel sheet and prioritize the things that you need to do and get you started. Beyond that, if you're looking for further investment opportunities or a true financial assistant that's going to stay with you, then those become more billable hours or more of service that you would have to pay for. But they're going to get you started on the right path and redirect you.
Yeah, so kind of that foundational framework, right? But in a legal situation or a divorce scenario, they're not going to be going to court with you. They're just
Correct.
helping you to prepare leading up to that and kind of understand what you may need to do to prepare. So thank you for that. As you mentioned, a lot has changed pre-COVID and post-COVID. I'd like to know, just kind of as the workforce evolves, what new challenges arise, or how do you see the roles of EAPs changing?
Yeah, I think so. They changed drastically, right, from before COVID to COVID, and now we're looking beyond. So the areas that they're going to have to be able to address is the continuation of technology improvements, AI intelligence, being able to offer additional support at the work site or from a virtual perspective in the way of workshops, trainings, and developments. They do offer trainings and developments today to workplaces to help management improve upon different from an educational perspective, or from the perspective of seeing an issue and being able to help redirect before it gets too far down the road and that person becomes distraught and not being able to focus and know what to do to continue on to their a good work day, things like that. Being flexible from a working support, right? Because we're all coming from a different background in how we work, right? You all have different, certainly different schedules than what I have per se. So how do we help the individuals that are working through night shift? And how do we support early morning individuals and just the day-to-day applications of any type of employer group? So they really have to be able to look at the industry and really tune into how can we improve our processes for healthcare, because healthcare operates quite differently than a manufacturing company, right? And healthcare is always on. There's no turn off. You got to go to
Right.
work, right? So they just have to be more in tune with how to address it. And I really do look for employer assistance programs that really can speak to me from an industry perspective, that really has taken the time to think about how can we address healthcare. They're different. So let's create the programs that work best for them. And that's what we push out. Things
Yeah.
like, does that make sense?
Yeah, and convenience. I've noticed that's
Yes.
changed over the years. You referenced earlier, you used to just, you would call this 1-800 number and that is how you got support. Now a lot of EAPs have websites. There's chat functionality available. It's 24/7, right? So we
Yes.
can't we can't possibly predict when we're going to need to reach out to an employee assistance program. And therefore, they've kind of met that need by being available 24/7, offering website resources available at your fingertips for sure.
Right.
Yeah, Leah, in your years of experience in just dealing with population health and wellness programs, can you share with us any examples of how EAPs may have helped one of your clients or an organization that you've worked with in the past?
Yeah, so we get emails quite frequently. And I love this. This is part that I love the most. It's no longer, you don't have to hide behind it. We all have concerns. We all need help sometimes navigating through the complex world that we're in, right? So I get emails. Well, I'll just use a personal example. I have two daughters. They're young. One is in healthcare, and she sees what you see every day. It's a lot. And she just came to me one day and said, I've got some anxiety and I don't know what to do with that. And I said, great, you have an employee assistance program. Let me tell you how it works, totally between you and your provider. And you just dial that number and get access. And I have to tell you, she's not afraid to tell me, I love my therapist. And I'll call him a therapist coach. She talks to him on a regular basis. And he's helping her articulate how to handle certain situations. I mean, in my day, you just figured it out. But today, if I would have had the resources I have today, things would have gone a lot smoother maybe in certain situations, right? So I think our younger population is not afraid to say, hey, what's my resource? I want to tap into it. So I love that. And I think that's a beautiful thing. I'm trying to think, just other situations would be kind of more in line with the whole additional program support. I'm taking care of my mother. I didn't know what to do. I have to get to work and she needs help on a regular basis. And they set me up with a caretaker that could come in a certain number of hours and also show me where I might have the opportunity to tap into her benefits to help support the cost of that. Um, there's just so many things, but I really believe that people are just happy to have that offering.
Yeah,
Childcare is another huge one. Childcare is huge, especially for a healthcare worker. I see that a lot because you have to get to your shift and your child gets sick, and now you have to figure out, I need somebody to come here now because they can't go to school, and I've got to get to work. So that's another area of assistance they can provide in helping find that child care who's already sourced, who's already been vetted, and has a background check and is safe enough to come into your home and place them there within a certain number of hours.
yeah.
So lots of different ways. It's just there's so many pieces to this.
Yeah, there really are. I know you gave the great example of just kind of your daughter's experience. And I think that, one of the things that is another common misconception is I have to be dealing with some sort of acute crisis, right? In order to really reach out to an employee assistance program. I think oftentimes people don't realize that it can be, I'm experiencing anxiety or I'm feeling some burnout. I'm under a little more pressure or stress, that I normally am. I think to piggyback on our last session about sleep, it may be, suddenly I'm really having a hard time sleeping, and the EAPs typically have resources that will speak to those kinds of things, which again, it's all about full well-being, well-being of the employee, which means well-being of the employee's loved ones, which is,
Yes.
oftentimes why they're extended out to those family members. Um, Leah, just I guess the last two questions I would have. The first one is, what other common misconceptions or myths do you hear about employee assistance programs that you would like to kind of, address on today's call?
Confidentiality is number one,
Yeah,
first and foremost. It is. It's everyone's concern. And if there's one thing I can convey, um, it doesn't need to be a concern. It truly is protected. And the numbers are out typically on your intranet. They are. So look for them on any of your employer websites. I think no one knows when you call.
yeah,
No one's getting a report with the name of the employees that are at their group calling. As I stated, and I mean this wholeheartedly, they'll get a report that says, here's some areas of need. Now, we use that from my perspective when I'm talking to my clients. I use that from the perspective of saying, hey, here's our top 3 areas. We need more support. EAP is not enough. So
yeah,
here's what we have from the community. Here's what we have through our other benefit offerings. And we need to build an education and communicate that to the employees so they know these resources are here. Benefits are overwhelming. We have so many to choose from, and we don't always know where all the hidden fruit is. And so it's real important to uncover those and to be able to communicate that back to you. But truly, confidentiality is certainly a true benefit through this particular offering that is adhered to. It is
yeah,
between you and your EAP provider. That's number one. Number two is I think people think that they have to be depressed or they have to anxiety or they have to have a crisis going on. Absolutely not. As I stated earlier, if you have a situation, say you're at work, you have a situation with a coworker, you don't want to go to HR, you're afraid it might get back. But how am I going to address that with my coworker so that I can continue to be productive and positive? And
yeah,
so that's where you would tap into your EAP, and through that initial assessment, that inceptor will redirect you to a coach. And that coach, you just explain what's happening and that you need some pointers on how do I address this. And then you continue to have that conversation with your coach as you work through that issue, and you will work through it. But I think it's so important to understand that this particular program truly can help you in every aspect
mhm,
of life. Don't just think it's for one or two things. It's not just psychology or psychiatry. It truly is not. It's
yeah,
so much more. And some of these vendors today have so many programs that they're offering, group support, lots of different workshops you can tap into, or webinars, or like, how Calm is set up and they have meditation. Many of these vendors have meditation, resiliency programs. There's so much
yeah. I was
embedded
just
in.
going to say, Leah, that's a really good point because I think, many of the programs also have more of professional development type content in them. You kind of mentioned, there's some conflict resolution, effective communication or active listening. So I know that the Ingenivis Health EAP, there's a ton of resources out there from the perspective of being a leader and leading teams, so beyond the mental and physical well-being and elder and child care and all of those great benefits that are offered,
Yeah.
there's always some little nuggets in there that I think people aren't expecting. And it's like you just have to go and look and then realize the resources in there can not only help you personally but also professionally as well. So last question, we're coming down to 6 minutes. We had a question in the Q&A that I wanted to ask you. So the question is, do employee assistance programs help with tuition assistance or reimbursement?
That would be the financial aspect of that. And that particular piece of the equation would be adhered to through with that question. So yes, you tap into your EAP, you're looking for financial services, and you ask all the questions, and they'll redirect you on how to assist with that. That's a huge one for
Yeah.
sure.
Yeah,
And they'll
great
provide the
question.
resources for
Yeah,
sure.
great question in the Q&A.
Yes.
Well, Leah, I want to thank you again so much for joining today. I know employee assistance programs are highly underutilized. I think a big driver behind that is just being misunderstood, as well as having some of those misconceptions that we talked about today. So I appreciate your time. I hope that for all of our attendees, you've learned something new about your EAP. If you are unsure whether or not your employer offers one, I encourage you to reach out to the Human Resources Department at your employer, or Human Resources here at Ingenivis if you're an employee.
Thank you, Jen. I appreciate, and I hope it was very helpful and beneficial.
Yes, thank you so much.